All right, good afternoon, everyone, and welcome to our webinar tonight. It's on fundamentals, so it's part of our Stock Sense program. So I'm Jack, the project officer here at Stock Sense. So Stock Sense is a project run by the Victorian Farmers Federation. We're funded by the Cattle Compensation Fund and the Sheep and Goat Compensation Fund, and it's delivered by the VFF Livestock Group. Stock Sense was established to help Victorian livestock producers maintain and improve animal health, welfare, as well as Victoria's overall biosecurity status. So we do this through numerous ways. So we run educational workshops around the state, which include fencing workshops, animal husbandry, and we have these webinars like this series we have on the last 2 weeks. We develop fact sheets and we distribute of related industry material through social media and e-newsletters, which are called quarterly. We have a few upcoming events. So tomorrow we have the fourth part in the webinar series with Pete Ronalds. It's on regenerative futures and smarter farm planning. And then on the 25th of February, we have Humane Euthanasia of Livestock Workshop in La Pen. That's in with a collaboration with Dairy Australia. On the 20th of March, we have a fencing and biosecurity workshop in Daylesford. So tonight we have Dr. Andrea Redgewell. So she'll cover key aspects of preventative herd health, including vaccinations, parasite control, nutrition, biosecurity, and animal welfare. We'll have practical guidance will be provided, particularly relevant to small farms, lifestyle properties, and peri-urban landholders to improve herd health, reduce disease risk, and support productivity. So a few housekeeping things before we get started. So there'll be a Q&A session at the end of the presentation. So it'll be 1 hour and with the 30-minute Q&A at the end. I'll send these slides out after the webinar, so you'll get a link to the recording as well, and it'll be uploaded on YouTube. At the end of the fourth webinar, the final one, we'll send everyone a survey. If you could fill that out, that would be greatly appreciated. It helps us improve these in the futures. And subscribe to VFS Stock Sense on YouTube, and you can see all our past webinars. We've got numerous ways you can stay in touch. So we've got Instagram, Facebook, Twitter, and YouTube. That's our email there and our website. So I'll pass it over to Andrea and she'll kick off the presentation.
Thanks, Jack. All right, I'm going to do the classic. See if I can share my screen to get this going. All right. Is that looking good for everyone? Jack, does it look right to you on your end?
It's not sharing at the moment.
It's not sharing. Oh, it's stopped. Oh, it says it's sharing. Bear with me then. Let's have a little look. Which is why we had a practice run beforehand, but now it's not working. Apologies, everybody. Let's see if I can. It says it's sharing on my end. I wonder why.
No, I can't see it at the moment.
All right, let's have a look. Let's try again.
Yeah. Oh.
Now?
Yeah, you got it. Yeah, I can see your screen. So if you go to
all right, I'm going to put it on slideshow again because I had to get out of that. What's a Zoom webinar without some hiccups in the beginning? Hey, that's always the way. Is it the right screen now?
It's on the. We can see the other stuff like the. Yeah, that's it.
Now,
beautiful.
Is that it?
Yeah,
all right.
Perfect.
Sorry, everybody. Luckily, I tend to be a better vet than I am on technology, so that's always something. My name is Andrea Redgewell. I'm a vet and director for 2 vet clinics out in the Yarra Valley. So my understanding is that we might have participants from all over the state. But yeah, we work in a sort of peri-urban area with a lot of hobby farmers, small production farms, and a wide range of animals. I do have an extra interest in production animals, herd health, and as well as medicine and surgery of larger animals. I also do have a bit of a passion for public health and biosecurity. That's sort of what I like to do. So hence why I've been invited to do a talk today, which is nice. So thank you for having me. So we are going to talk about animal health, nutrition, and welfare. So this is just a quick rundown of what we're going to cover today. It looks like a lot, but I'm going to break it down. So we'll talk a little bit about preventative health versus treating sick animals, facilities and safety on your farms, biosecurity and quarantine, And then I'm going to go into what preventative health is and how it includes things like vaccinations and drenching for parasites. We're going to cover very slightly a little bit about nutrition, body condition scoring, and then towards the end, we'll talk about common signs of illness in livestock and when to call the vet. So with animal health, we can sort of divide it into preventative care versus treating when an animal is sick. So if you think of a vet clinic, you might think of a dog being sick and being brought into the vet. But when we work with livestock, we try to also work with animals that might not yet be sick to try to prevent them from getting sick. So that's what we call herd health, and to try to keep them healthy rather than getting called out when one or several individuals are unwell. In saying that, though, obviously we still treat sick animals. So that what we do is we focus on the herd and the production rather than the individual itself. And what are the benefits of doing that is you often get increased production, reduced losses, and it's also very good animal welfare to keep them healthy rather than wait for them to get unwell. So with preventative herd health, that tends to include vaccinations, parasite control, nutrition, hygiene and husbandry, and biosecurity. And that, in my little mathematical formula, equals good animal welfare. But before we get into the health part of things, I wanted to talk a little bit about husbandry and hygiene. And one big thing can be overstocking, and that's going to depend on where you live and how much land you have and what you have growing on your land. We see a bit of overstocking in the Yarra Valley because people's properties tend to be a bit smaller, and we see things, the problems that bring will be things like increased parasite burden, poor feed hygiene, depending on what time of year it is. So we get quite wet winters where we are. And we can also then get reduced production gain because of a lower body condition score, that there simply are too many animals and not enough feed. And hygiene, we want to make sure that we focus on clean water and feed bins when they're, especially if they're sharing a tighter space. What do we do with the manure is very important to think about if you don't have the luxury of a very, very big area. And also how to keep ground cover dry and clean. So again, that's going to depend on where you live and what your climate is like and how you can best work with that. So these cows are actually from Europe when I went on a workshop in Denmark. So I don't often see them looking this bad. These girls were happy as pigs in mud, but obviously this is not ideal. This is a very high traffic point around the feed trough, but as you can see, they literally have mud up until their knees and their hocks, which, as you can imagine, can be very bad for their feet. They look happy enough there, but they had a big other space as well. But just a good idea of what it shouldn't look like. Just quickly on biosecurity, it shouldn't maybe be quickly because it's very important. Even if you have a small property, it could be good to consider who's visiting the property, where have they come from, and why are they there? It's another a good point to keep in your mind. If they drive onto your property, do they all have to drive down to the yards where your animals are? Or can some people, if they just want to see your animals, depending on what size of property you have, do they all have to drive down? Or can some of them go at foot to reduce the risk of tyres bringing things onto your property? Depending on, again, what type of operation you're running and who you got coming, you could consider things like protected clothing and shoes. I actually have a few properties. They've just gone to Bunnings and bought a pair of gumboots in my size. And when I go out and attend their property, I just change my shoes into the gumboots that live there, so that I don't bring anything from any other properties onto theirs. So yeah, so gumboots designated for the visitors is pretty good. And one property, I know they have a range of 5 different sizes in case I have a vet student with me or if one of my colleagues come along. And yeah, it's not a very expensive investment, so that can work quite well. It is really good if there are water sources around your property to wash our hands, as well as our gear or scrub our boots, that sort of thing. It's things that you can think about in terms of biosecurity. And foot baths for new animals or for humans for that matter too can be quite good and good to think about. Under biosecurity, I wanted to talk about quarantine of new animals. That's probably the number one reason we see illness in herds that haven't yet been there prior. So it is very good to have an enclosure or a fenced area or a paddock that new animals can go into with no nose-to-nose contact. So they shouldn't be sharing a fence line with your stock or the neighbour's stock, ideally. So it is good to make sure that there is some space in between that. There's a bit of range of recommendations of how long the quarantine period should be, but I would say that the absolute minimum should be 5 days. But if you can, 3 weeks is probably ideal to really cover all the different diseases that we see in Australia, diseases and parasites, to give that time to display any illness before you join them in with your mob of animals. It's good to give them a drench on arrival with ideally a 3 or 4 active ingredient product. If you can get a history from the people you have bought the animals from, things like vaccination status, drenching status, any illness, depending on, again, what type of animals you're running. And that's, again, the vaccination status. It's quite common. I hear, oh, they came fully vaccinated, but we actually don't have evidence of that. So it could be good to know that and potentially vaccinate at this. It doesn't cost very much to do a 5-in-1 or a 7-in-1 vaccine. So that could be worth looking into. And then when they're in that quarantine area, it makes it easier for you to monitor for any signs of disease, whether that is diarrhea, coughing, nasal discharge, anything like that. And that brings me into housing and shelter. So in Section 9 of the Prevention of Cruelty to Animals Act, there is actually cruelty offences in there that you require to have a proper and sufficient shelter provided for your animals. There's no details maybe per se of how much shelter you should have per head of animal, but ideally you want to make sure that it's not overcrowded. And what are we sheltering from? We're sheltering from the elements, so sun, rain and wind. And heat stress in Australia in particular can be fatal, and that's probably more of a challenge than the cold weather where we are compared to in other countries where they might put shelter up because of the cold. But in saying that, in some areas of Victoria in winter, we do see a fair bit of lamb losses if you have winter lambing. So that is often due to lack of shelter from the elements. So you can look at things like, have you got trees in your paddock that can act as shelter? Otherwise, can you put up any sheds? Can you put any shade cloths up if you're running a smaller little herd, or have if you have them in a yard because they're in a hospital pen, something like that, maybe a shade cloth will suffice. But make sure that you have enough shelter to limit the competition. If it is really, really hot and the animals are fighting over getting into the shade, then that also increases their body temperature further and their energy consumption, and that can make it worse if they have to fight for the space. And on facilities, I really wanted to highlight safety, safety, safety. And maybe I'm seeing that of an occupational health point of view as we come out as vets. We very often get called out to cattle properties in particular, and there are no yards or no crushes. So the first question my receptionist and nurses ask new clients who call up is, have you got a crush? And that is a pure safety reason for us, for you, as well as for the animal. Because if we're no good to anyone if we get injured, and we also can't facilitate what we need to do. It might be different if you have a down cow and they're really unwell and we can't move them. That's different, because then they tend to not try to hurt us as much either. But in saying that, they can still do a fair bit of damage even if they're down. So yeah, it's just worth looking into the facilities that you have and making sure that you're safe. For sheep and goats, smaller holding yards are good, ideally a race to run them through. And if you've got a crush or a handler, that's really good as well. This is a milking goat down here that's ready for milking, but it also works excellent as a vet examination area, and for us to take different types of samples in a safe way. So yeah, just a little point for that. So I'm going to actually just do one slide on a crush because it is really important. Ideally, a head bale, especially if we're going to examine the head, we need a head bale to make sure that we don't get injured. We would love a kick gate behind the cattle. There's also all different types, obviously you can get the Rolls Royce of crushers, so there's different gates for safe access, both low and up higher. And if possible, on my wish list, there's also a chin lift so that we can safely, again, work on the head. So to the right here on the slide is one of my colleagues examining an eye, and we end up taking out a third eyelid on that cow. And it makes a big difference that the chin can be up like that, and we can then put a head halter on and tie her head safely so that we can do the job. And down the bottom there is me just the other day out on a fire-affected area, dealing with some burnt feet. And you can see, so the cow's restrained with a head bale at the front. And then we have a lower side gate so that I can tie up the foot and I can stand quite safely outside of the crush but still have access to her foot there, whereas some crushers will open the whole side gate as a whole, which then means she could just walk all over me with her back end. So yeah, there's different varieties, but safety comes first. So yeah, worth looking into if you haven't already. All right, so then we're going to quickly go on to the health part of things. I just wanted to make sure that we covered a bit of the facilities first and focus a little bit on the biosecurity, because it's all well and good to try to do the right thing, but if we can't deliver the right thing, or we bring diseases into the property because of lack of biosecurity, then it's sort of not quite, it's been done for nothing. So yeah, I just wanted to run that by you first. So with vaccinations, that means that we're immunizing a group of animals to protect them from disease. That is what we're doing. We're getting their body system, we're helping them to mount an immune response to if when they are exposed to the actual disease, they are ready to go to protect themselves from that and not get sick or die. So it reduces the risk of the individual getting sick, but it also reduces the shedding of the disease to other animals as well, which is really important. And if a property keeps up with this year after year, decade after decade, you will also then potentially, depending on disease, have less of a prevalence of the disease on your property. So I'm going to go into some different types of diseases we vaccinate against, but some of them live in the soil on the property. So if we've then, reduced that risk of shedding into the environment, you're going to over time have less disease in your ground as well. So why do we vaccinate? We did point out that just before, but to improve animal welfare by hopefully keeping them healthy and not getting them sick and unwell from the diseases. We can also see a reduced economic loss by getting improved production because we don't have sick animals. We have reduced fatalities. We sometimes, depending on the disease and the vaccination used, we can also have reduced reproductive problems and then reduce veterinary cost. As much as you might love seeing your vet, if we don't have to come out and treat your animals, that's obviously better. And a big factor here is that if you've got improved herd health, you improve public health in some areas. So there are certain diseases that can go on to humans from your animals, so we get a reduced risk of that, and whether that is through direct contact with the animals or through consumption of food derived from animal products. So when we get into what type of vaccinations we use, the most common vaccines used in our area, and when I say our area, it's probably Victoria wide, but there are some areas that might use a different protocol depending on where you are. But 5-in-1 or 7-in-1 are the two most common vaccines used. So the difference between those two is that a 5-in-1 covers your clostridial diseases, which we're going to cover in a second, and a 7-in-1 do them 5 plus leptospirosis, 2 different strains of that. In sheep, we tend to use a vaccine called Glandvac, which is also the clostridial diseases plus cheesy gland. They come in slightly varieties depending on how many varieties of the clostridial diseases they cover. And depending on where you live, it is good to get advice from your veterinarian if there is a particular high risk of something in the region where you are. Other vaccines that we see are things that cover respiratory diseases, such as travel sickness. There's also salmonella vaccines on the market. There's a vaccine now for Johne's disease, Gudair, pestivirus for BVDV. Pink eye vaccine is becoming more popular. And then there's also Barber's pole vaccine out on the market now. So there's a few different types, and there's some more on that I haven't put on the list here because there's certainly a lot out there. So what are clostridial diseases? Sorry, I should maybe have warned you before the pictures came up. There are some pictures from a couple of properties that I've attended over time for sudden deaths in cattle. The diseases that we see that are clostridial diseases are enterotoxemia, which is pulpy kidney disease, commonly seen in sheep more so than cattle. Tetanus, which all of you would have heard of, because obviously that's something we vaccinate ourselves against. Black disease, then we have malignant edema, which is a similar disease to blackleg, but tends to cause swollen heads in rams, and then blackleg in cattle and sheep. Clostridial diseases are all spore form type of diseases that live in the soil, and they can survive in some regions depending on the weather and the climate for decades, and that's why it can be really hard to get rid of and to not, we don't declare any properties free of them. I've had several properties that might have vaccinated for 30 years and then they've said to me, I haven't had any problems, so I've stopped vaccinating And then 3 years later, all of a sudden they have quite a few drop dead in a matter of a few days because it is in that soil, and the animals get it into them through consumption of soil when they graze. Leptospirosis was the 2 strains that are in 7-in-1. They are recommended to any cattle that are breeding herds. So if you only run steers, for example, and you don't do any reproductive work, then you might not need it. Again, this is something that you need to decide based on the risk factors that you have on your property. The reason leptospirosis is more a risk factor in a breeding herd is that it can cause reproductive losses, abortions, and infertility, things like that. And I know quite a lot of areas in the dairy type of district, they do this too because it is often spread through urine, and people who milk are sort of exposed to cattle urinating, for those of you who aren't from a dairy background. Which also then leads me into the occupational health risk of this. So leptospirosis can also go to humans. So it is very good to cover if you've got staff or yourself working with animals, especially breeding herds in cattle. Cheesy gland is something we see in sheep. So as this picture shows, I've borrowed this picture. All the references are under the pictures if I've stolen the pictures from someone else. It's basically a caseous lymphadenitis, which is a pussy lymph node, essentially, you could say. So we get abscesses in the lymph nodes that we often see in the lungs on post-mortem. They can survive in the environment for up to 8 months, again, depending on the weather conditions. And basically, they spread when the pus is burst out of that abscess. So it's quite often seen as spreading during shearing time, where they might get a cut or something like that. And then that shearing instruments are used on the next individual and they get a cut and so forth. And like I mentioned earlier, the vaccine of choice is GlandVac, which is a combined vaccination for this, as well as those clostridial diseases we mentioned earlier. All right, so here's a standard type of protocol for common vaccines. Again, you need to look at the inserts of the packet and make sure that that's correct for that product, and get advice from your vet if you're unsure. And some of these vaccines are not registered for all species of livestock either. Goats and camelids can be a bit iffy sometimes in terms of what they're registered for, but we still work with the recommendations when we give advice to our clients. But for cattle, you want to start the first dose at sort of 6 weeks of age and then do a second one 4 to 6 weeks later. So that tends to, the first one tends to coincide with marking, and then you run them through again 4 to 6 weeks later. An annual booster for adults, ideally in the breeding herd, you want to do cows 4 weeks prior to calving. Otherwise, you do it annually ongoing. So if it's a steer herd, once they've a year after that second calf booster, then you just do it yearly after that until they're done. The heifers that aren't yet being put in for breeding, you do their annual booster 12 months after they had their second calf one, and then after that 4 weeks prior to calving. And that comes down to that you want to have those maternal antibodies during pregnancy so that the lamb, calf or kid are ready to go when they hit the ground and have some protection from their mum. In goats, they're a little bit different. So you want to do their first one at minimum of 3 weeks of age, the second one again 4 to 6 weeks later. They ideally should have a 6-monthly booster of vaccines because they're very sensitive to one of those clostridial diseases, the enterotoxemia one. Depending on where you are as well, if liver fluke is a high risk in your area, you might want to do regular boosters of this because they are also very sensitive to black disease, where liver fluke plays a role in the life cycle of that, the transmission of the disease, I should say, and the progression of the disease. So that's, again, depending on where you are, have a chat to your vet and get the best sort of protocol for that. And in sheep, the scientific recommendation is to do the first dose at marking and the second dose 4 weeks later. So that depends on obviously when you decide to mark, but most people do that at 2 to 4 weeks of age, and depending on the spread of lambing time. And then annual boosters after that. And just like with your cows, your ewes should have it 4 weeks prior to lambing to boost that maternal antibody for the babies. And that brings us then into parasites. I'm going to do a brief parasite presentation on what we see in cattle and sheep and goats. So in parasites in cattle, in intestinal worms, it's most common that we see roundworms. There's a few different types: Osteotargia, Coperia, and Trichostrongylus are probably the most common ones. We also sometimes see a bit of Homunculus in there as well. And if you have a high worm burden, we see things like scouring, anorexia, that they don't want to eat anymore, they're lethargic and ill thrifty. Basically, stress on the immune system can make them more prone to then other diseases. So sometimes we might come out to a very sick cow and they actually have another disease going on, but they also then have a very high worm burden. And whether or not what was the chicken and the egg, we don't always know, but it is good to make sure that they have a low worm burden to make their immune system less stressed from the worms to then be stronger against other challenges that they might have. In our area, we see quite a bit of ticks in our cattle and potentially also some diseases that are transmitted by the ticks. That the jury is out a little bit on that, but we certainly see a bit more bush ticks come in with wildlife onto our properties, kangaroos, deer, that sort of thing. And the one we tend to see here is the bush tick. So it could also be worth trying to find. It can be hard depending on how big your property, how big your herd is, to try to find some sort of tick prevention depending on where you are. So ticks are part of external parasites, so parasites on our skin, so ticks, lice, and things like that. There's also drenches that help reduce the flies around them to help reduce the risk of pink eye transmission as well. So sorry, I should go back there. So in terms of the wildlife, a big thing to do, we're going to talk about a bit integrated parasite control in a few slides. And one thing that some of our farms here have had to start doing is try to focus a bit more on wildlife control, whether that is fences or even culling on some properties where the deer have been quite extreme, just to try to reduce the risk of these external parasites coming in. In sheep and goats, we mostly see intestinal worms, and until proven otherwise, it's very often Barber's pole or Homunculus. That causes anemia, so low blood volume or blood levels, ill thrift, and bottle jaw. I find it really hard this picture of a sheep here I took a few years ago that had a very classic bottle jaw, but I do find that it never really does it justice on a photo. We're going to talk a little bit soon about body condition score, but I'm sure you can appreciate that his backbone's quite prominent here. His hip bones are quite prominent. So he's quite skinny essentially. And underneath his jaw, you can see that he has a swelling. And that is our classical bottle jaw. And maybe if you put your critical glasses on, we might be able to make out that he has a bit of a swollen belly down below as well. And essentially what happens is that you get body fluid build up in your tissues, making you look swollen despite being quite skinny. Another common worm is brown scour worm, and as the name suggests, it does cause diarrhea. It also causes anorexia, that they don't want to eat, and ill thrift, that they're not well. And then we have the small brown stomach worm, which they all quite do similar types of clinical signs or symptoms, but the small brown stomach worm tends to cause rapid onset, like you get sick quite quickly, whereas with the Barber's pole, that can actually seems to be able to be quite chronically or quite long-term infected with a semi-high burden, and then all of a sudden they get really sick, but they've actually had it for quite a while, whereas the small brown stomach worm tends to kick in quite quickly. We see some Coperia sometimes, which also causes our scouring, also death. And then again, external parasites on their skin. We most commonly see itch mite and lice. And the giveaway is that they've scratched on their fences, and you see a fair bit of wool if you have a sheep herd on the fences and you see them scratch. I wanted to touch on the FAMACHA scoring, which is a very handy tool to have at home. This has been developed for sheep and is very useful in goats as well. They developed this for the nomadic people in Africa that might not have had access to see vets with their animals that they sort of wander with. And it's telling us the level of anemia and whether or not you should drench your animal. So you do, as in this picture, that you push gently on the eyeball and avert down the lower eyelid to see what the color of that mucous membrane is. So the eyelids should be nice and pink, but if you're getting down to the lower two here, number 4 and 5, that they're quite white, that indicates anemia. And the number one reason for anemia in sheep and goats would be this Barber's pole worm. We're going to talk about other diagnostics as well, but this is just quite handy to have at home. If you have a goat or a sheep that you find is not doing all that well, it's a very quick and easy and doesn't cost you anything to do this test. And our vets all have this laminated in their cars as well to quickly be able to show a client, the different levels of pinkness. So you can just Google the image, print it off and have it down in your barn kind of thing to be able to see. Even if you don't want to use it as a drench guide, it could be a good guide to know if you need to call your vet. But the main and the best way of diagnosing if your animal has worms is a fecal egg count. So there's myself sitting at a microscope doing it. That's a colleague of mine, Courtney, in their lovely job of collecting these fecal egg counts in this group of goats that she's dealing with there. And basically, it's used to diagnose worms. You send a fecal sample off to your vet or to your livestock kind of store. Hoogies do them sometimes. I'm sure LRs do them as well. And there's different labs that do it that you can post them to directly. It's quite cheap and easy way to know if there are any worms or eggs present and whether or not you should drench. If you don't want to do this prior to drenching, if I have clients who don't want to do too many tests, then I get them to then drench and then do a reduction test afterwards, which again is collecting the feces, send it in to me, and I'll have a look and see. And ideally, we should have minimal amount of worms or eggs after a drench, and that is telling us whether the drench was effective. Because it's all well and good to drench, but if we haven't used an appropriate product, if we haven't used enough, or if you've used a method that, sometimes oral drench don't work very well in alpacas because they'll spit it back out, that sort of thing. So it's good to know that the money that's being spent on the drench is actually working, but also out of a wider picture that we're not getting resistance. So ideally, this test is done 10 to 14 days after drenching. And then your vet or your lab can tell you, yeah, there's no worms or no eggs. That was an effective drench. Or no, actually, this one still has a very high one. And you can try to problem solve of why that could be the case. So then it's all well and good to know we have these parasites, but you might want to know, how do we control them? And we talk about drenching, which is essentially deworming, deparasiting them. Ideally, we do that based on a fecal egg count. There's oral versions, there's pour-on, or there's injectable versions. And ideally, you should use a combination drench, which means they have 2 or more ingredients or active ingredients in there. So this is just a picture of one. I'm not affiliated with any companies and I'm not allowed to in any way advertise them, but Trifecta is one that we use in the clinic, but there's also Tridectin and Trigard. They're all sort of the same from different companies. Or you can use 2 or more products as well if you don't, it is hard to get one product does everything. But make sure that when you do this, you read the labels to ensure what parasites it covers, as well as the doses on it. It can be quite hard to learn how heavy an animal is. And if we don't have scales available, it's a bit of a guesstimate if you haven't been around it. What you can do if you have a farm friend or a neighbor that do have scales that they use for their animals, it can be good to hang out with them for the day to sort of see, okay, well, that cow weighed that much. That's about the same size as mine at home, so that you're doing it right. Because underdosing can, firstly be ineffective then for the parasites that your animal has. But also then what happens is that we kill some parasites, but the stronger ones, if you will, survive, and then they reproduce and get stronger babies. And then all of a sudden we have super parasites, to put it easily said, and that contributes to that resistance. And yeah, like I said, there's no one model fits all kind of thing. So a combination drench or more than one product is the best way to go. And on the risk of resistance, like I said earlier, make sure you drench to the correct weight, do these fecal egg count reduction tests, like I mentioned earlier, so 10 to 14 days after a drench, make sure that it was effective. It's also interesting because we have local resistance as well. So depending on where you live, one product might work really well for you, but my client here might have resistance on there. I even have neighboring properties that, I got an ivermectin resistance on one property, but it works really well at their neighbors. So there can certainly be local resistance, and that could potentially be because they've not killed all of the worms when they've been treated in the past, and those super ones have reproduced and made super babies. So when to drench, that's the never-ending question. New animals, and don't forget when you get males onto your property for joining. So if you get bulls or rams or bucks onto your property to join, just remember that they are also considered new animals to your property. Ideally, drench based on fecal egg count. So I have some properties that don't drench anymore. They've had 2 or 3 years of no drenching because of different types of parasite management, and we do those every 6 to 8 weeks. We do a fecal egg count and it's still sitting very low, then we don't have to drench. It's good to rotate your products. So even if you are using combined products, it is good to rotate them so that you don't get that resistance as well. 2 to 4 weeks before lambing is good to drench, though, to make sure that you don't have a worm burden prior to lambing. And at weaning is very good to do as well. But it's not just the drenching that helps our parasite control. So you would have heard the term rotational grazing. So a lot of these parasites live in the manure that sort of sits as a bit of an incubator. The temperature is perfect for them in there. They're sort of saved from the sun. They're not getting washed away with the rain. So it is good to have, if the paddocks are continuously grazed by the stock, especially young ones, there will be a high burden of worms in there. And remember, back on the overstocking of animals, that means there's a lot of poo around in your paddock. So you want to try to make sure that that doesn't happen, and then move your stock from one paddock to another, however often. So that's going to depend on your property, your climate, and what you have accessible for you in terms of cleaning up manure. If you have other species that you can rotate with. So it's hard to, again, give one sort of set recommendation of how often to rotate. But it is good to make sure, even if you're on a small block, you might only be a hobby farmer, but instead of having one big paddock, see if you can divide it into 2 so that you can have one spelling. You can also then do that rotational if you don't have the luxury of having one paddock stand empty. If you have different species on your property, you can rotate them. So horses, for example, they don't tend to share too many parasites with our ruminants, so they're a good sort of swapping with. But also cattle and sheep, they share, they don't tend to really share parasites with one another. However, goats and sheep certainly do, and they can be more susceptible than the other kind of thing. So I would sort of not rotate them as such without spelling in between. And cleaning the manure, again, some of you are probably on hectares and hectares of property and you might not ever need to do this, but where we live and work, quite a few people, they're on an acre, maybe 6 acres, like it can be quite small, and they have to actively clean out their paddocks, whether that is to muck them out or to let the sun dry them off and then go with the harrow over it, that sort of thing. So that is certainly something that we need to recommend our clients here on smaller hobby farms to reduce that parasite burden and the manure that they live in. All right, we're going to just touch quickly on nutrition. Nutrition is certainly not my strongest suit, and I take my hat off to the agronomists and nutritionists around, and I work very closely with a few of them here to make sure I give good advice to our clients. So that's my first advice: get advice from the agronomists who know what they're talking about. In Victoria, we are known to be low in several minerals, and depending on where you are, there might be some that are worse than others. So it is really important and good to do a soil testing of where you are and act accordingly. So whether you need to supplement your pasture with whatever minerals that you're lacking. For the animals, that means that most of our people here in my region have to supplement with salt licks or minerals into their feed. So that whether they're salt licks or they put powder into making sure that they get that the soil's deprived of. We often do a fair bit of annual blood testing to check what type of deficiencies the actual animal might have as well. So depending on how many animals they have, we do a certain percentage, and we'll try to do, some that look in good body condition and a couple of samples of the ones that are maybe in poorer body condition. And that gives us an idea going into, say, joining, if there is any further supplementation that should be done. And that can help as well, things like grass tetany, staggers, milk fever, and pregnancy toxemia, because we can look at those minerals and see how they're doing, essentially. And then we often give injections to help boost further, depending on where you are. But where we are, we certainly find that multimin works a treat. Again, not affiliated with any companies as such, but that's just quite a good product that we use before joining and before giving birth. And on nutrition too, I just wanted to touch on water because water is key. We need to always have clean and accessible water, especially during these hotter times that we're in at the minute. Please make sure that your automatic troughs are working. As late as yesterday, my husband got called out to a horse, which is obviously not a livestock animal as such, but got called out to a horse that was colicking, and the trough had stopped working that morning and they hadn't drunk all day. Several water points are important to have, depending on how many animals you have, but all it takes is one of them to do a poo in the water bucket. If you only have a handful of sheep and you only put one bucket of water in, all it takes is one. I fished out a dead bird out of my horses, but in my horse bucket the other day, and I was happy that I had more because the horses wouldn't drink out of that one. So yeah, just several water points, very important. One cow can drink up to 140 litres per day if they're in the lactation state, so that's a lot of water. And AgVic has a bit of a water calculator actually on their website, which can be quite handy to look at as well. So just don't forget water. All right, going to go in a little bit on body condition scoring. We tend to score them 1 to 5, but some scores go 1 to 9 as well to sort of allow, it's almost like that half point. So sometimes you might hear people saying a score of 6 or 7, and you might say, hey, that's only 1 to 5, but there is an extended 1 to 1 from 1 to 9. And in our cattle, we're sort of feeling behind the short ribs, as seen in this picture, and over where the tail head sits. I have borrowed this from Zoetis. They have a very good summary of this, and instead of reinventing the wheel, I borrowed this and give them the give them thanks for lending this to me. So a body condition score 1 is basically as skinny as it gets. So you will see that the backbone's very prominent. You will see the hips and shoulder bones very prominent, and you'll see the ribs clearly visible, and basically they look like a skeleton. This is not an acceptable body condition out of an animal welfare point of view. If you are in the dairy industry, or if you ever look at a dairy cow versus a beef cow, they will naturally look different. And a dairy cow looks skinnier than a beef cow. And it's because they're made to do different things. That doesn't mean that a dairy cow should look at body condition score 1. But sometimes I'll get a question about that their hip bones are very prominent, but then that's when you feel for the behind the short ribs along the backbone there to see that she's filled in there instead. So this is a score 1. And then we have score 2, 3, 4, and 5. So on the 2, you can still see the backbone and the hips and shoulders. The ribs are sort of faintly visible, but they are a bit bony sort of still. A body condition score 2, we're still aiming to get higher. So ideally you want them to be around 3, but that again is going to depend on where they are. So if they are just about to calve, you might want them to be a little bit higher, but not too fat, which is a problem we have in the Yarra Valley where beef cows, quite a few of them are score 4 and 5, causing issues at calving time. But if you just look at a blanket animal, score 3 is ideal, 2.5 to 3 kind of thing. So on condition score number 3, we can only feel the short ribs when we squeeze really firmly. There should be a bit of fat cover on either side of the tail head up the back end there. We can sort of make out the hip bones, and this is where it's going to be a bit different for you from your dairy cows, but there should still be a bit of fat cover over them. And the body outline, they've called it smooth, and I would describe it like that too. There's no sort of lumps and bumps from the skeleton. It's just like a bit smooth. Number 4, we're sort of just starting to get into a bit of the chunky section here. We can't feel the short ribs, and there's a fair bit of fat around that tail head. And the ribs are very well covered, so you might be able to feel them if you push really hard. And yeah, they're overall quite round. And then body condition score 5, that's quite an obese animal. And you see fat deposits around the tail area quite often. It's almost like it hangs a bit of fat deposits around the back end there. And they are bulging and very fat. This is also not an ideal body condition score. Then we go on to our sheep, which also do the 1 to 5, and similar position. You want to palpate or feel along the backbone and the end of the short ribs, just like in that picture there. I borrowed these pictures from Ag Victoria. And essentially, you want, again, a body condition around 3. If they're starting to go down towards 4.5 and 5, that's when we're starting to see problems with lambing and things. And the reason a higher body condition score makes it hard for them to give birth is because if you can imagine the vaginal canal and where the baby is meant to come out, as we're bulging on the outside of fat, we're bulging towards the inside as well. So the birth canal gets smaller, a smaller diameter for the animal to come out. So that's essentially why we don't want that to be, want the mums to be too heavy. That's the main reason for that. And very similar type of staging here with the body condition score in sheep as to cattle. So in an ideal one for number 3, we can only just sort of feel the vertebrae under a layer of fat and muscle. We should be able to feel every rounded bone there, but we can't push in between the vertebral, so the backbones. We should not be able to feel the gaps in between. Whereas when you look at 4 and 5, they fill out quite a lot there, bulging, and you can't really feel the backbone at all, and that's too much as well. Alrighty, so we're going to just talk a little bit of different signs of diseases in livestock. Probably one of the first or slightest signs you might see is that they're falling behind the mob. They're not keeping up at feeding time or milking time, or depending on what type of production you run, but they're basically falling behind, the stragglers. Coughing is another sign of disease, runny eyes, diarrhea or scours, poor doer, so they're just not putting on weight or producing as much milk or whatever it is that you're running. They're losing weight, losing that body condition. They're reducing appetite, so they're not eating as much. Lameness, grinding their teeth is a sign of discomfort and sometimes pain, which could indicate that there's something going on. Discharges, essentially from anywhere, but the vulva, absolutely. And pale mucous membranes. So mucous membranes, those of you who don't know, it's the inside of our eyelids, it's the inside of our mouth. So depending on what type of animal you have and their color, it can be a bit hard to tell the color of their mucous membranes. In female animals, you can also look in their vulva and sort of fold it back, and that's another spot to look at what the color is. So they should be a nice sort of salmon pink, just like us, inside our mouth. The same type of color should be in your animals. And if they're pale, that can indicate different types of diseases. So when to call the vet, which is like the $1 million question, I suppose. So any of those signs that I just mentioned on the previous slide can be urgent, and it can definitely be useful to call a vet, even if it's for advice. And sometimes you want to do things yourself, which is fine. So diarrhea could indicate parasites, like we talked about before, the scale worms and things like that. And a drench could definitely help. So if they're otherwise doing well, and you're only seeing dirty bums, then by all means, maybe it is worms. But if you are getting animals that have bad scouring, but they're also not getting up or they're not eating and drinking, then it's still, very much important to call the vet. So it's so hard to give general advice, because I don't want to be the one who has advised you that you don't have to call a vet and then something bad happens. But absolutely monitor a sick animal for a couple of days may be okay, but you need to make sure that their overall health is number one. So if the combination of things, if there is scouring, but also not eating, laying down much, and drooling, a few things, then you need to call a vet. So yeah, like I said, if they're not eating or drinking, just call the vet for advice. Things that shouldn't wait: a down animal that can't get up, a birth that's not progressing, non-weight bearing lameness, neurological signs. Neurological signs are things like circling, erratic behavior, seizures, basically appearing drunk or under the influence. Just not quite right, loss of balance, that sort of thing, dragging feet. And things like respiratory distress is very important to call the vet. So that is trouble breathing or breathing up heavily, open mouth breathing if it's really bad. Those are things that definitely shouldn't wait, and you should get a vet out as soon as you can. We work a lot on herd health management plans in our practice to try to help and get the farmers a plan of how to keep their animals healthy. Basically, what we do is we go out once a year. We sit down over a cuppa, we chat to the producer, we talk about how their reproductive results have been, calving rates, production numbers, depending on what type of production they're running. But if it's a dairy herd, then we might look at milk yield. If it's if it is a beef herd, we look predominantly on reproductive numbers to see that things are going well there. We give advice on health aspects, guidance, and practical help. So some of our clients are complete beginners. So the first year we might be out helping them with things like vaccinations, marking, all of those things, and then sort of train them up to be self-sufficient and do those kind of things themselves. But if we go out once a year, we can have a relationship with our farmers where they can get medications via phone consult if they need to, and not always need a vet to come out if it is something a bit simpler. And the reason I'm mentioning this is because it's not unique. That is something that you can work out with your vet as well, if that was something that you would be interested in, because it certainly seems to be helping. I have quite a few clients now that are sort of seeing their return on investment, if you will, looking at this, and try to really work on towards having healthy animals. And then you can sort of have your vet in your toolbox for when something goes wrong. And yeah, it's just something that, it's worth keeping in the back of your mind, and maybe contact your vet and see if that's something you guys could work on together. We also offer things like the market insurance program for Johne's disease and CAE. That's mainly for sheep and goats that we do that in our area. And then we do a bit of brucellosis accreditation program too. So there are obviously a few programs out there for all of you producers, and it is important to remember that your vets are here to help you, and hopefully can help those things and accreditations take place for you. That was just a little bit of a side point. So just a little summary of what we've talked about today. Sorry, I might have gone a bit short on time here, but vaccinations, really important to keep your herd healthy and avoid diseases that can be fatal. Parasite control and the importance of integrating it, and not only relying on your drenches that we are sort of starting to get resistance against, and there might not be any new products coming. Obviously, the pharmaceutical companies and the researchers are working really hard, but it's like our antibiotic use, one day we might stand without anything. So if we can get into the habit of getting an integrated parasite control, rotational grazing, that sort of thing, be really good, and thinking of our stocking rates. The importance of nutrition. I know I only just briefly touched on this, but if we don't feed our animals, they don't give us back in production. Hygiene and husbandry. We talked about the importance of biosecurity of new animals as well as people coming onto your property, and if you can avoid the risk of diseases coming into your diseases and things like weeds and stuff as well, obviously. And then we just quickly talked a bit about herd health management and the importance of trying to aim for healthy stock so that you don't end up with losses or sick animals. This is just me doing what I do best, cuddling some sheep with my big pregnancy belly there. And just make sure that you have a good sort of toolbox of people that can help you out, whether it's your agronomist, nutritionist, people from stock sense, advisors, stock agents, and your vet, because we're all here to try to work together with you. And I think it's question time.
Yeah, we got a few questions here. So if you have any questions, just send them through, and I won't read out a name or anything, so they can be anonymous. We got one here. So how do you protect goats against lepto if you're using Glandvac?
That's a good question. Well, firstly, I guess you need to decide whether you need to do it. You can also combine these vaccines. I would read the label in there, but you could potentially use a Glandvac. There's different levels of Glandvac, and maybe combine that with a 7-in-1. I would also just have to double check, because you might be able to get the lepto vaccine standalone by itself as well. I will need to look at. I've not had that question before, but I know that you can combine the vaccines if you sort of have to. So it could be a good one to look into and see if you can combine them.
All right, beautiful. So we got a question here. So if an animal misses a booster, do you have to start the course again, or do you just continue on kind of when you realize?
Usually it's all right to continue on when you realize. Again, Goats can be very sensitive and specific there. So just try to basically catch them up as soon as you can. It is hard because the products, not all of them are registered for goats. But otherwise, with your sheep and your cattle, most times just catch them back up in terms of just when you realize, get them into the schedule of where you should be.
For cattle, would you recommend an annual drench for a program for the whole herd? And if yes, would you do a fecal count for all animals or just pick a sample of animals with different body condition scores?
Yeah, that's a very good question. It's hard to recommend a blanket rule. I certainly think all animals need to be checked if they need to be drenched annually, if not more often. And if you have a big herd of animals and you do a pooled sample, then you don't necessarily need a sample from every individual. So then I think it is a good idea to look at different body conditions in your herd and get a few. Basically, I guess you can say if a couple of them have worms in the paddock, you should drench all of them. But what you can have is that if you only take poo from one and that particular one is not shedding parasites at that point in time, you might get a false sense of security that there aren't any parasites in your herd. So definitely include a few animals out of there. And if you can then do different body conditions, is really good. And if you've got one or two or a couple that are showing signs of diarrhea as well, make sure that they're part of that pool as well, because they might be the ones that are actually shedding it compared to some of the others.
We have a question here, so about overdosing. So can in like both vaccinations or drenching, can the animals potentially overdose from it?
So with the vaccinations, they're meant to be quite safe. And if you're not sure if the first one got in when you have them in the race or in the crush, do another one. That's usually quite safe. I've never heard of any issues there. It's better than to do one more than to have missed that animal, especially the newborns or the young ones, so that they don't miss out on their, fundamental protection. In terms of drenching, there is certainly a level of toxicity there, depending on which drench it is. So some of them will have a toxicity rate. Ivermectin, for example, can be quite dangerous for them if they get too much. Especially if you're starting to come up to sort of 5-10 times the recommended dose, we do see some neurological illness in them and even deaths. So it is really important to then read the label on it, try to get an idea of how much too much you gave them, and then call the vet and get advice. Some products are safer than others in terms of overdosing, and some are not really safe at all to overdose. So the best thing is to just be familiar with what product you're using, try to work out how much too much you gave and get some advice on that.
All right, beautiful. We have a bit of a statement here. So someone's just said they're pointing out the Multimin is not registered for goats. And also we got a question here. Could you elaborate a bit more on the use of blood tests, particularly in sheep?
Yeah, sure. So that's correct. Multivin's not registered for goats. Quite a lot of products are not registered for goats. And unfortunately, we have a fair bit of alpaca clients as well, and that's an even harder market. So a lot of times, products are used off-label. In goats, we do have a lot of research on the market, which is excellent. So most of the time, if not always, we can back it up with experience from the wider veterinary community and farming community. But that is correct that that's not registered for goats. With the blood test, there's different types of blood tests, but what we tend to run, if we're looking at, so where I pointed out the blood test is a nutritional herd health study, where we look at the micronutrients and look at things like magnesium, selenium, zinc, and seeing if they're deficient in that, and then help us guide whether they need more supplements or different types of supplements given in different ways. And where we are here, we had some losses at one property because it's deficient in zinc. For example, we have a fair bit of magnesium deficiency in our soil here as well. Then we try to do blood tests once or twice a year depending on how big the farm is. If they've got 100 head, we might do 5 or 6 animals. It comes down to the cost, of course. Whereas if there's only 7 animals, we might take one that looks the poorest to see that that's an example of where the potential malnutrition has come in. And then together, with what's been analysed in the soil. They can come up with a plan with their agronomist of what they might need to do to supplement the grounds, and with me, what we can supplement for the animals' intake.
All right, beautiful. There's also a question about vaccination. So if you accidentally inject yourself or get stabbed by the gun, should you be worried about that?
Well, the blanket answer is that if you do inject yourself, that you should seek medical care and ideally take the box or the bottle with you so that your doctor can see what you've injected yourself with. Some of the vaccines have a higher risk of causing an injury to you than other vaccines. So the Glanvac vaccine, for example, the Gudair vaccine, there are some of them that are a bit more dangerous to people than some of the others. But the blanket rule is that you should always seek medical care and bring the packet with you so that they know what you've jabbed yourself with. Or you're muted again, Jack.
Is 3-in-1 all right for goats if you can buy it?
The short answer is yes. I mean, again, they're not registered for goats, but I've certainly seen it used before.
Yeah, and also another vaccination one. So if a second initial 5-in-1 vac is missed, is there any point in subsequent vacs, e.g. annual program?
Yes, is the short answer. So it's quite common what we see if we take beef cattle, for example, quite commonly what we see is that they might have been vaccinated as calves, potentially only once, and then they go off to, when they're old enough, they sort of go off to market and then they get sold on, and they've been told they've been vaccinated, but you need to do that annual vaccination because it doesn't last in their body, in their blood system for longer. There's reasons why it's every 12 months in cattle, because they simply, you can go in and look at the antibodies in the body system, in the blood, in the immune system to see if there is still any protection. And research has shown that after 12 months, there's not sufficient cover anymore. So then you want to boost it again.
Yeah, all right. Also, so is the antibiotic resistance, is that different between like injectable drenches or like just standard drenches?
The resistance in parasite control, do
Yeah,
you
yeah.
know what I mean? Yeah. Yes, so it's across the board, I guess. Like some products we have less resistance to, because we have maybe more than there's 3 or 4 ingredients in there, making it a stronger antiparasitic, if you will. It's not really the right terminology, but if you have a combined drench, it could be more effective than a single one. But in terms of resistance, we certainly see it across the board, whether it's pour on, oral, or injectable.
Yeah. So can cattle overdose on lick blocks or loose mineral supplements demonstrated by different manure to normal?
Um, I wouldn't say that you can see it in the consistency of their feces. Again, yes, they can overdose and you can get toxicity of different levels. It's unlikely in cattle, especially if they use it as like a lick, because they tend to only go and take it when they need it. However, in sheep, we need to be mindful of the copper, especially so that we're not overdosing them in copper. That's quite common. That can happen. You're trying to do the right thing. That's why, for those who saw the multi-min come as a copper-free one, for example, to make sure we're not giving them too much. But yes, they can overdose, but they need to have a lot for that to happen.
Yeah. I know you talked about the difference between species, like one animals that have together on your farm. But is there much of a difference between like the breeds of those species, like different breeds of cattle with like disease resistance?
So in terms of sharing parasites and things like that, if they're the same species, it doesn't matter what breed they are. So then that doesn't make a difference. So, if you've got merinos and you've got your Aussie whites, they're going to share the same type of parasites. There's certainly, there's research going into trying to make certain breeds or species, but breeds more resistant to certain diseases and parasites. I couldn't go into detail of which ones, would be more preferred than others, depending on what disease you're looking at. But certainly there are certain traits that might be more susceptible, but they still share the same risk of sharing parasites across them.
Yeah. So when you're doing like dosage for vaccinations, weight is important. Do you normally estimate, or is there a quick way to kind of measure if you don't have any scales?
So give medications or drenches and things that are based on body weight and you don't have scales, I think experience goes a long way. So if you've seen a lot of animals, if you've seen a lot of sheep and goats, for the smaller livestock, you could even bring your normal household scales out and lift one up and see how heavy you are together with it. It's obviously hard with a cow, but the smaller animals, you certainly can do that. There are some measuring tapes out on the market as well that people are using. They're not as accurate, but they'll give you an idea.
Yeah, beautiful. Well, I think we might nearly wrap it up there. A bit shorter than normal, but I think all those questions got answered. So we appreciate it, Andrea. Yeah, your presentation was very informative. So I'd like to thank you. And so everyone, if you could tune in tomorrow, we have Peter Ronalds. He's talking about smarter farm planning, so a bit of regenerative agriculture there. So thanks everyone for viewing, and hopefully we'll see you tomorrow.
Thank you for having me.